What I like about RCS is that they put together a work plan, they implement that work plan, and then they monitor that work plan, and they work with the staff. Very important. RCS is mentoring our staff, working with them, getting them to where they need to be so we can maintain our benchmarks. With that being said, as a CFO of WCA Hospital, I want to make sure we maintain that so I can see a long-lasting relationship with RCS to come in, on a periodic basis to make sure we're keeping those levels. And also, they have placed into our facility an interim revenue cycle director who's actually running our revenue cycle. So we have a multi-faceted project going on right now to, again, get us back to where we need to be after our implementation of our electronic health record, keep those benchmarks at the level that are best practice, and help us mentor our staff to get them so they can be on. Right away, the interaction was always positive. We had a work plan, kept it focused, and constantly, they were keeping track of the performance that they were doing, and it was very positive. And they're like an extension of our business office. That's the way I look at RCS. I mean, we're a community hospital, 343 beds, about 110 million net revenue. We serve a pretty much rural area, we have a small urban center, and so a lot of the employees have been there a long time. Many on our staff for 25 plus years, myself 29. So it's very important that the personalities, mesh, that somebody doesn't come in and overpower them, but work with them. The very positive, powerful thing that I saw was, from time to time, previously, a representative from RCS, who was serving as our interim director at the time, would attend our board meetings. And still to this day, I have the board asking me, when are they going to come back to the board and do your homework, research your firm, especially if you, like in our case, where we've had them back multiple times. That should be a testimony in itself that they're doing a good job. So to me, the results and the personalities. Again, when RCS comes in, they're not overpowering. They work with you, they adapt very well. We're, again, more of a rural facility. They adapt very well, and I've heard very positive when they go maybe to a larger system. They're always perceived, as a professional and well respected. Bigger is not always better. So when you look for a firm, look again at the results that they're having, and look at the recommendations, and make sure that they carry out the promises that they make. A lot of times, when you have a bigger firm, the principals of the company are not really hands-on. Many times, they're sending in junior level consultants who have not had the experience. I know with RCS, and I have a strong background in reimbursement, so I can tell right away if somebody comes in and if they know their stuff. So with RCS, you're dealing with the principals, you're dealing with the managers, senior level people. You're not dealing with a junior level consultant who's sort of fresh out of school and hasn't had the experience. Experience is key, and that's what you'll get with RCS is, experienced individuals who have a long tenure in the healthcare.